Yeah, I guess I have a question for Dr. Wayne, and I started asking the question while we were on break. And he had, on one of his slides, he talked about using AI in the field. And during the break, he explained a little bit about using AI for predictive diagnosis, like in the case of EKGs. And so I'm wondering if you can either expand on that or if you have any other use cases for AI in the field that you could share.
Thank you. So I think all of us have heard about artificial intelligence, and I think most of us don't quite understand what it is. But let's just say it is a way that we use computer networks to almost simulate what the brain does, but a billion times faster and at a much larger range. So I see three areas where AI is really going to help us a lot. Number one is I think it will really help us in how we educate healthcare professionals. Number two is I think it'll help us in how we manage how healthcare professionals manage patients. And number three is in research, in learning stuff that we just don't know now. Let me give you an example of how it can be used to help in patient care. So when a patient comes to see us, healthcare providers, we typically do what's called a differential diagnosis. So the possibilities are this or this or this, and then we try to narrow it down by doing further tests and so forth until we get to the final diagnosis. But it's often involving probabilities. So for instance, if I have a 70-year-old man with high blood pressure, high cholesterol, diabetes, and cigarette smoking, who comes in with chest pain that is typical of a coronary blockage, pressing substernal chest pain that occurs with exertion, I don't need to do a stress test on that person. There's a 95% chance or higher that that person has a blockage. Contrast that with a 30-year-old woman with no risk factors who has chest pain that will last for hours at a time and increases if she takes a deep breath. There's a less than a 1% chance that that's due to a blockage. So in situations where there are extremely high probabilities one way or the other, we don't need to do a lot of thinking about it because it's pretty straightforward. But that isn't where most patients come in. Most patients are somewhere in the middle where we need to try to factor out what it is. And here AI can help by, if it's been exposed to hundreds of thousands or millions of patient records where the AI machine knows what the outcome was and it can look at the predictive factors, then AI can really help. So a patient comes in, AI listens to the patient along with the doctor, and the doctor does her differential diagnosis, and then AI does it, and increasingly we're seeing that the AI assessment of what's going on is better than the doctor's. So I see, particularly in the management of the patients, an incredible opportunity for AI to help, not take over, but help, particularly on the diagnostic side. What's really going on with this patient? What are the proper tests that we should do? There, I think, increasingly we're seeing the potential for how AI can help.
Just like to add to regarding the diagnosis. So the way artificial intelligence platforms work is with training. So these AI computers are being trained on, like what Dr. Wynn has said, millions upon millions of patient data. And I think one way it can really impact, particularly from cardiology perspective, would be, these machines that interpret EKGs or interpret scans. So these machines can be exposed to a lot of EKGs, like literally probably more than 1 billion EKGs, and they can be exposed to the data like of these patients like, oh, this was a STEMI or a heart attack, but when they took him to the cath lab, they did not see that. That's one advantage of AI, wherein they can literally probably have a better interpretation of the EKG or interpretation of a CAT scan, because the technologies can be exposed to millions of scans where they could be looking at lung nodules, they can be looking at calcium in the coronary arteries, and these can be automated to a great degree, and it will enhance our ability to diagnose patients, which also helps probably in reducing unnecessary testing for these patients. You know, you can have a patient that the EKG looks like a heart attack. Right now, the process is it's seen by a provider, and then it's run to a cardiologist or an interventional cardiologist who makes a call whether or not this patient is having a heart attack and should go to the cath lab. A lot of those can sometimes be false positives, and you go to the patient, you take him to the cath lab, and they have no blockage. AI has the potential to help reduce these false positives, help reduce unnecessary invasive testing, or on the flip side, help detect these subtle findings that even trained eyes may miss.
Thank you for being a part of the Rock from the Heart community and for joining us today. Your presence and engagement make a huge difference in raising awareness and building a stronger support network for those affected by aortic and heart valve disease. Thank you so much for attending today.